In the small group market and the individual marketplace, any policy purchased after January 1st, 2014, or on your anniversary, January 1st, 2014 and beyond, every small employer goes through what's called modified community rating. Modified community rating does not impact companies that have found themselves to be 50 full-time equivalents or more. They do not have to go through modified community rating. But modified community rating is the technical term for how much is my rates going up, essentially, if we can boil it down to that. Here's what happens in the small group marketplace is, when our plans renew, if we look at our current rating methodology, an insurance company takes on a group plan, might take a 20-year-old and see that his rate is $88 or $100 for that 20-year-old male. A 64-year-old male might be $650. We work on a 7, 8 to 9 to 1 spread between the youngest and oldest on a group health plan. Now, if you pay one rate for all the employees, how they determine that is they just figured out what the average of all those employee ages are. So that's the current world. In 2014, that has to go to 3 to 1. Insurance companies know, however, that we need $650 a month to cover a 64-year-old male. So magically what happens to the 20-year-old is they go from 100 to 250. So the groups that are most adversely impacted by modified community rating are ones that hire young males. Female groups are a lot less impacted. Most of the groups that we have that have majority of females working for them have almost no increase, no impact in the rates. The other things that impact our rating methodology is if you're a healthy group, if you have all healthy employees working for you, you get an increase because they can no longer charge different between healthy and unhealthy. If you are a group, however, we have quite a few clients that have been rated up as a group because of their health history as the employees, and they'll actually see rate decreases in 2014.